Peace, everybody. It's your girl Soul. Back for Women Wednesdays. Let me post my comment, my pinned comment, and then we can get into it. Hello. Ooh. Okay. Hope my connection stays. Alright. Hi, everybody. My name is Soul. I am one of the community health influencers for Whitman-Walker, and also one of the art educators for the Corner DC. I'm just here for Women Wednesdays to share a little bit of information about PrEP and PEP, which is what we'll be talking about in our bag series tonight at 8:30. The bag series is a space for women to gather. Right now it's virtually, to unwind and to learn from one another, and we'll experience music from DJ Alex Love tonight and talk through sexual health catered to women. So tonight's topic is going to be about PrEP and PEP and HIV prevention, specifically for women. And just so you know what we're in for, we break the bag up into 2 rounds featuring 30 minutes of music and 15 minutes of sexual health talk. And that's through a 1.5 hour span. My pronouns are she, her, hers, if you're wondering, and if you're thinking of referring to me in any way. So let's get right into it. We're going to be talking about HIV prevention and 2 tools that you can add to your sexual health bag, aka your toolkit, PrEP and PEP. So let's just talk a little bit about HIV first. HIV is the human immunodeficiency virus. It's a virus that attacks cells that help the body fight infection, and they making a person more vulnerable to other infections and diseases. HIV can only be transmitted through 5 bodily fluids. That's breast milk, blood, semen, vaginal fluid, and rectal fluids. It can be spread through unprotected sex or through sharing injection drug equipment. HIV impacts the body by destroying CD4 cells, which are your helper T cells. They prevent essential immune system functioning and make the body more susceptible to opportunistic infections like pneumonia. So now that we know what HIV is, let's talk a little bit about some tools that can help prevent HIV, and we'll start with PrEP. PrEP is a pill that you can take daily to reduce your risk of contracting HIV. It can be up to 90% effective in preventing HIV transmission through sex, or 70% effective in preventing HIV transmission through injection drug use. A brand name is Truvada. It's important to note, though, that PrEP is a pre-exposure sexual health tool. This is something that you take consistently for 20 days to work towards protecting your yourself from HIV. It's most effective, like I said, when it's taken consistently for 20 days. We say 20 days because that's the time frame that it takes for PrEP to be present in the vaginal tissue. And it's important to note that PrEP is only effective in preventing HIV. It can be used with other HIV prevention methods as well as STI prevention methods and contraceptive methods. But it does not prevent STIs or pregnancy. So this is not something that you can use to prevent yourself from getting other STIs or prevent yourself from getting pregnant. This is only for HIV prevention. Some of the things that will help you decide whether you want to use PrEP or not. You want to use PrEP if you don't always use condoms or barriers. You don't always ask your partner to wear a condom. You've been diagnosed with an STI within the past 6 months. You're unsure about your partner's HIV status. You're in a relationship with an HIV positive partner who may or may not be in HIV treatment. Or you're a person who injects drugs and are in a sexual relationship with someone who does. Other ways are if you're HIV negative and just interested in PrEP, as another thing to add to your bag. If you have sex with multiple partners, if you change your partners often, if you worry about getting HIV and that affects like the way you enjoy sex, if you worry about getting HIV and that stops you from having the sex that you want, just go ahead and look into PrEP because it could take away those worries and anxieties. If your partners are known or suspected to have other partners, you can look into it as well. Also, if you are from a country with a high HIV prevalence, for example, Sub-Saharan Africa and Southeast Asia, or if you travel to those countries with high HIV prevalence and have sex with the people that you meet there, you might want to consider PrEP. So, again, PrEP is a pre-exposure sexual health tool. And then the next tool that we can add to our bag is PEP. PEP is different from PrEP in the fact that PEP is post-exposure. So this is after being exposed to HIV. It's to help prevent you from becoming infected. It's a post-exposure sexual health tool. PEP stands for post-exposure prophylaxis, and it means taking antiretroviral medicines, or ART, after being exposed to HIV and you're worried about becoming infected. PEP should only be used in emergency situations, though, and must be started within 72 hours of your possible exposure to HIV. It's not a substitute for regular use of other proven HIV prevention methods such as PrEP, which means taking HIV medicines daily to lower your chance of getting infected, using condoms the right way every time you have sex, and using only your own new sterile needles every time you inject are also ways to protect yourself. PEP is effective, but it's not 100% effective. So remember, you should continue to use condoms with your partners when you're having sex. You should continue to practice safe injection practices when you're taking PrEP. And these strategies can protect you from being exposed to HIV again and reduce the chances of you transmitting HIV to others if you do become infected while you're on PEP. So just like we talked about last week with condoms and barriers, these are all tools that you can use together. With PrEP and PEP, you are still recommended to use condoms. You're still recommended to use barriers and dental dams and all that good stuff to protect yourself and to keep yourself healthy. But that's it. as far as the topic goes today. Thank y'all for joining me. Remember to follow us at Whitman-Walker on Facebook, Twitter, and IG for more sexual health education and the most up-to-date information about Whitman-Walker health services. And don't forget to register for our bag series tonight. We're going to talk more about PrEP and PEP and just share more information and talk about, if we use them, who uses them, and maybe some people will share their experiences. You can register through the link. Oh, I posted the link wrong. I will repost it. It's bit.ly/bag RSVP, all one word. That's BAGGRSVP. So don't forget to join us. See you there. Bye.